Okay, welcome everyone. Good morning, good afternoon, good evening, wherever you might be joining from. Welcome to the Let's Teach Planetary Health webinar. My name is Ashley Imone. I am one of the working group members and I'll be one of the moderators today. I am coming to you from the University of Toronto in Toronto, Canada. And I just want to start with a little bit of information about this group. This is a follow-up of the roadmap and action plan that was set at the last Planetary Health annual meeting in Malaysia last year. It includes a group of 30 plus volunteers from around the world who are really laying the groundwork for the deliverables of the steps that were laid out in the action plan. And so we are one of the subgroups, one of the sub-working groups focused on mainstreaming planetary health for all levels of education and educators. And we are made up of 5 members. So myself, Ashley Imone, from the University of Toronto in Canada. We have Stacey Villegas from Johns Hopkins Institute for Planetary Health in the United States. Anusha Seneviratne from Royal Holloway University of London in the UK. Carlos Ferran Guzman from the University of Maryland in the US, and also Yelena Malagaski from the Planetary Health Alliance. And we also have joining us today Hannah Turley, who is also from the Planetary Health Alliance. And so for this webinar today, what we are really trying to do is mainstream planetary health education and also take this opportunity to conduct basically like an informal needs assessment to see how we can assist all educators at all levels in embedding planetary health into curricula. So with that, welcome again, everyone, and I will turn it over to Stacey.
Great. Thank you so much, Ashley. Welcome, everyone, and we truly appreciate your attendance this morning. Um, I'm Stacey Villegas. As Ashley just mentioned, I work with the Johns Hopkins Institute for Planetary Health here in Baltimore, Maryland, and I work specifically within the education program here. So one of our main priorities here at the Institute is to really embed planetary health curricula amongst the entire JHU community. So I will be briefly going over our webinar agenda and a little bit of some housekeeping notes. So if you have any questions or concerns, we're not going to use the chat today. So please be sure to use the Q&A option, and we'll have someone monitoring that chat just to make sure every question is answered and every concern. So once again, thank you, Ashley, for the brief welcome and introductions. We're going to have some icebreakers that I'll hop to next. We're going to go over what is planetary health and why teaching it matters. And then we're going to go into why and how and who to teach planetary health to, as well as conduct a bit of an informal needs assessment here. And we're going to be doing this through an audience sorry about that, through a poll. So this will kind of be our more engaging portion of the webinar. And then we'll have a Q&A and a wrap up. So please make sure to put any of your questions, once again, as I mentioned, in the chat. But there will be many of opportunities to engage with our panelists here as well. So I'm going to move on to the next slide now. And this is our Mentimeter board. So I'm not sure if many of you are familiar with Mentimeter. If you want to use it, we really are encouraging you all to use it. To just use this website here, you just hop onto menti.com. And then you put in this code right here, and it'll allow you to answer some of our polls that we have today. Hopefully it works. It should. And if it doesn't, just feel free to put any concerns you have in the Q&A, but I'll allow you guys to have 60 seconds to just go ahead and pin where you are joining from this morning. Oh, amazing. All right. Let me see. people popping up all over the map. This is awesome. Great. Everyone is calling from around the globe. This is so exciting. See, someone has raised their hand. Give me one moment. All right. To the person who just raised their hand, if you want to put your comment in the Q&A, that might be the easiest, unless you want to raise your hand once more. Otherwise, we're going to move on to the next question. So thank you all. This is so amazing to see that we have everyone from around the world joining us this morning. All right, I'll give it 5 more seconds. 5, 4, 3, 2, 1. Thank you all. So the next question is, let's see. Okay, go ahead and enter. We have 55 players still joining. Amazing. Just wait for a couple of you more to join. Oh, nope. Here we go. So the next question here is, are you currently teaching planetary health? You can take your time to think about this one. Andreas, you've answered in the chat no. Lucia, you have raised your hand. Do you have a comment you wanted to share? All right, 10 more seconds. Okay, so we have a good chunk that have said yes to teaching planetary health. And the am I maybe, that's a decent response. So some of you may be touching on specific topics that are adjacent or related to planetary health, but don't exactly utilize the term planetary health. So that is why we did put that option there. Awesome. Thank you all for participating. I'm going to go on to the next portion of the webinar. So I will now hand this off to Yelena, who will touch on what is planetary health and why teaching it matters.
Hi, everyone. It's really a great pleasure to be here today and to be a part of this conversation about planetary health and planetary health education. I'm very happy and excited to see how many of you have accepted our invitation to Let's Teach Planetary Health. My name is Jelena Molgajski. I'm the Education Director with the Planetary Health Alliance. And in this role, I focus on advancing planetary health education globally. Before joining the Alliance, I was spent 7 years as an assistant professor in a graduate public health program in New York. And prior to that, I was a lecturer and researcher in the Netherlands at Maastricht University. I started my career as a primary care physician in Serbia, where I'm from. And in Planetary Health, for today's webinar, what I would like to tell you about is a bit about what planetary health is, the concept. I know that some of you, 46 of you, answered that you already teach planetary health, and that is great. But I find that in these kind of spaces, I meet people who are very familiar with the concept and the framework, and feels the conversation a bit like preaching to the choir or being in an echo chamber, but sometimes we also meet educators who have never heard of the term before. So we're going to find the balance a bit and introduce the concept first. Next slide, please. The concept of planetary health was first articulated exactly 10 years ago in 2015 in the Rockefeller Foundation Lesson Commission report on planetary health. So as you can imagine, this is a very important anniversary for us this year, for the planetary health community. Planetary health is a solutions-oriented, transdisciplinary field and social movement that focuses on analyzing and addressing the impact of human disruptions to the Earth's natural systems on human health and all life on Earth. To put it simply, really, planetary health examines all the ways in which humans have endangered and compromised the Earth's abilities to serve as a support life system for all of us. Next slide, please. When I talk about planetary health and kind of try to introduce the concept, I like to make 3 key points, or ask the audience to kind of make note of 3 important points. The first one, that the planetary emergency is a health emergency now across all dimensions of health. The scale of environmental disruption that we are witnessing in our everyday lives has moved from being just an environmental conversation and has become a humanitarian crisis and a global health emergency that is driven by human behavior. The second thing, something that we often like to say, is climate change, and it's everything change. And what we mean by that, that's often the conversations around the global environmental crisis focus solely on climate change. And we just think that it's very important. It is our aim in every conversation to widen the scope and remind ourselves of the other elements of the global environmental crisis that also demand our attention. So just to give you a few examples, if you look at the numbers of deaths estimated to be caused by air pollution, more than 8 million people has died because of air pollution last year. And that is more than deaths of malaria, tuberculosis, and AIDS combined. Or if we think about the loss of biodiversity, which is another major concern, then we know now, the research has shown that when biodiversity declines, the host-specific zoonotic host happen to thrive, and that increases the risk of infectious disease transmission. Also, another example is the overuse of pesticides and land degradation, which in addition to climate change exacerbates further food system vulnerabilities. So I think when we talk about planetary health, these things are important: transdisciplinarity in approach in research and teaching, and remembering that the global environmental crisis happens beyond climate change. And finally, in a throwback to my clinical background, I believe that only the correct diagnosis of a planetary health emergency can lead to the correct treatment. And for us in the planetary health community, that correct treatment is the great transition, or the deep structural change in the way we live on Earth. Next slide, please. So just to go back to this notion of climate change and everything change, I'm not going to go do a deep dive into all the topics that we consider to be planetary health topics. I would just like to point out that we have divided the planetary health topics into two categories: environmental changes and health impacts. And each of the ones that you can see listed here on the website, you can find on the slide, you can find on our website. And it's a really in a nice summary on the planetary health topic, which is also linked to the most relevant current research on each of these topics. So it's just talking about teaching, where we are now moving, in the importance of teaching planetary health. I just wanted to mention that if you are interested in any of these topics, the Planetary Health Alliance's website is a great place to start and explore other dimensions of the global environmental crisis beyond climate change. Next slide, please. So I mentioned the Great Transition as the response to the crisis that we find ourselves in, but the question is, how can planetary health education support that Great Transition? And we believe that that planetary health education is intrinsically linked to the concept of the Great Transition, because we need to learn to do things differently. And that knowledge and skills and inspiration for the behavioral change that is needed to make this shift can only come from education. So if you ask me, what do we need to learn to do differently? The answer is almost everything. We need to differently produce and consume food and manufacture products. We need to construct different cities, reimagine the cities we live in, and construct sustainable cities for the future. We have to differently learn to manage our natural resources. And on a more personal level, we need to rethink the way we plan and raise our families, and also the way we understand success. And I'm not talking only the macroeconomic success still measured in these days with the GDP, but I'm talking about the personal success. And finally, what we need to learn, and what is the role of planetary health education, is also to make us think about our role within nature and in relation to nature, and to kind of learn and internalize this move from this duality of us being something separate from the nature, and realizing that really we are the one. And just on that note, what often happens when even happens in, not often, but even in conversations about planetary health, I hear that people say planetary health and human health, or human health and planetary health. And I just always have to kind of jump in and say, well, they are the same. You cannot have healthy humans on an unhealthy planet. Next slide, please. So where to start? I'm not going to, obviously, I would like to say that we have, there is a wealth of resources available for those of you who are already teaching planetary health, or you are interested in starting. So it really depends. I don't want to do a deep dive in all the resources that are available. We're going to share those with you in the follow-up email to this webinar. But I would like to kind of give you some ideas depending on where you are. Let's say you are a middle school teacher, or so that would be in the US, or some you are teaching at the primary or secondary level education. And then you would like to start somewhere. And I would like to point you out to the planetary health education posters that we have created. We have two. Here you can see one of them, what is planetary health. The other one is titled, what is the Anthropocene? And in addition to, you can see that the poster is, so it's freely accessible. You can download it on the website, and all the planetary health topics that I mentioned earlier are listed here, together with teaching guides. So each of these topics is accompanied with a teaching guide. So next slide, please. And this is how one of the teaching guides looks like. You have all the materials, activities, and the whole class basically planned to teach one of the, each of the planetary health topics. Next slide, please. But let's say you are teaching the high school level science, and you are thinking about what books could you share with your students or use to get inspired. So you can use one of our books, Planetary Health, Protecting Nature to Protect Ourselves, is a textbook by Samuel Myers and Howard Franklin. but also we have an amazing ebook, which was created by the high school educators from South America, Planetary Health educators, which offers a really rich tapestry of narratives of their personal experiences in teaching planetary health to students at the high school level. Next. Or you are in a situation that you would like to teach planetary health, but you feel that you need to learn more in order to actually take that step and start teaching it. Then I would suggest you visit our global inventory of planetary health programs and courses, and they're really focused on these 18 open access courses you can find there. These courses range in length from 4 hours to a few weeks. And the majority of the open access courses are really introductory in nature, kind of laying the groundwork for understanding planetary health and teaching planetary health. Next one. Or if you are writing your first planetary health syllabus and ready to submit it to the curriculum committee at the university you work at, then maybe you want to look at other people's syllabi and kind of compare what you want to teach with what others are actually teaching when they say they're teaching planetary health, and look at the various instructional designs they're using. Our directory is really collection of syllabi from educators from around the world. Or, and that is really useful, case studies are amazing tool, and they are useful at all levels of education. So you can find a number of case studies created by the Planetary Health Alliance, but as well case studies created by our partners and collaborators that we share that are maybe more focused on certain disciplines. Such as medicine, nursing, public health, and more. And thank you. That's all I wanted to share. And Carlos, the floor is yours now.
Thanks, Yelena, and good day and good afternoon, good evening to all of you. I saw people all over the map, which was quite exciting. I tried to position myself in Costa Rica, but I think I landed somewhere in the Galapagos, given that I did this from my phone. My finger, I think, is not as refined as I would have hoped. So, as I just said, I'm calling in from Costa Rica, and I am a Costa Rican, and I've been working with the Planetary Health Alliance almost for 10 years now, where I've been focusing a lot on this work around education. But I'm also an associate professor at the University of Maryland, where I teach global health. So, as you know, global health and planetary health are quite interrelated, if not they're kind of two threads of the same a string. So for me, it was quite a natural starting to teach global health and eventually moving into planetary health. And now I have one foot in another, if that's even possible. But in the next 10 minutes, if that's even possible, I'll speak a little bit about the why we need an educational reform, the how to teach planetary health, and who actually teaches planetary health, right? So Yelena really really laid out the why. And I think the everything change really captures the urgency of the air pollution, the biodiversity loss, the infectious diseases, the climate change. And that's really a clear picture of the state of the situation. So, as I said, what I want to do now is build on that foundation and focus on the how mostly, right? But so, very simple, important question I think would be what when you all out there are thinking about the type of education, right, that prepares students to confront this ecological breakdown, at the same time to prepare students, right, for tackling health inequities, and at the same time, right, not just understand these crises, but being able to act on them. And this is where planetary health for us comes in, where it's, at the essence, as Yelena was explaining, planetary health is about the interdependence of people and planet, and it's deeply grounded on equity and justice. So start thinking about what this actually means for curriculum reform and how to think about education in the future. So next slide, please. Next slide. Forgot to say next slide. So why do we need to rethink education our current model, if you think about it, is still very compartmentalized. So there's, health faculties in one side, environment is sitting in another silo, economics in another, social sciences are in another. And it's really up to students then to kind of stitch up these little pieces together. And in reality, the real world doesn't behave like that, right? The problems and the challenges that we face don't really respect those silos, whether it's, climate related illnesses or food insecurity or forced displacement. These really are cross-cutting challenges. And education must follow that, right? It can't be living in silos. It really needs to be a representation of the real world. So it has to be transdisciplinary, has to embrace complexity, and it really importantly has to build agency for change. And it must integrate much more than just facts and knowledge. It actually must bring ethics, compassion, system thinking, and praxis, right? So preparing learners not just to analyze the world, but being ready to transform it and be part of a new transformed world. Next slide, please. And this critique that I'm summarizing here in a couple of words is not new. This is back in 2010, which feels like an age ago, right? This is a Lancet Commission on Health Professionals for a New Century. And I use this document a lot to guide my work. And it warned that education, was not keeping up with global challenges. And they described very clearly in the document that curricula was fragmented, outdated, static, and as it says there, the result was that graduates were ill prepared for the reality of the world. And although this specific report focuses on health professionals, the same critique still applies broadly today to all of education. Curricula all over the world still very slow to adapt, even as the changes that we're seeing, like climate change, biodiversity loss, are really accelerating. And that's where, planetary health and the documents that we use in planetary health and the framings that we use in planetary health, such as, Sao Paulo Declaration and the Planetary Health Education Framework that I'll talk about in just one second, really are calling from an urgent transformation. So this document, although it's 15 years ago, really is the same challenge that planetary health face today. How do we prepare graduates that are only not just competent, technically in the, technical sense of it, but also are leading change in a world that is quite intertwined, interdependent, and as well a bit uncertain. Next slide. But it's not, all doom and inertia and no change. There are signs of progress, and I always like to point to this example of the Academic Health Institutions Declaration on Planetary Health, which was led by the Associations of Faculty of Medicines of Canada. So shout out to Canadian colleagues that are here. And the declaration frames planetary health as a code red emergency, and it calls on all institutions, especially higher education institutions, not just with a statement, but it calls on them to do curriculum reform, research reform, and transition to climate resilient institutions. And several schools, some of them quite big on names, such as McGill, McMaster, UBC, University of Calgary, have not just signed on, but have already shifted and started working on the change. That really, this for me shows that concrete steps are possible and that transformation is already happening, right? Which is part of how we talk about planetary health is also talk about the hope that it can happen. Next slide, please. So now we're going to move about a little bit just into the what to teach. Next slide. And this what to teach section, I'd really like to summarize on this figure. You have the citation there, but there's a resource as well accessible that Yelena was pointing to in our website that you can go and visit and just put Planetary Health Education Framework, Planetary Health Alliance. Something will come up in whichever search engine you're using, right? What actually is that we're teaching? So the Planetary Health Education Framework tries to provide, at least in a domain fashion, how you can guide content design, how you can guide curriculum design. And these are not meant to be rigid and compartmentalized domains, but you have to think about these as intertwined threads, right? Or adaptive scaffolds, depending on the language you speak. And I always like to start with the first one, which is the interconnection within nature in which what we say is that students and learners need to be both ecologically literate and have a felt connection with the natural world. Now, when you think about natural connection with or connection with the natural world, that's not something that we talk about a lot in higher education. So it's not just about reciprocity and dependence. It's not just about the science. It's a combination of this. You know, how do we foster a responsibility and care? How do we motivate action to sustain life across people, planet, and time? Right? So that's the interconnection within nature domain. It's this fostering empathy and compassion to act with our natural surroundings. The second one would be the Anthropocene and health domain, which is very clearly, very connected to how we understand how these human-driven disruptions that Yelena was talking about are connected to health outcomes. So how climate, biodiversity loss, land use are leading to things like malnutrition, vector-borne diseases, heat stress, right? The third one, and these are more about lenses, both equity and social justice and systems thinking and complexity, about lenses on how we tackle on these challenges, how we find solutions. So equity and social justice is about addressing structural inequalities, colonial legacies, racism, because we need to understand that most of these challenges will and are impacting communities quite unevenly, right? And so this focus on social justice and equity really ensures that we don't just study problems, but also address their roots. And then systems thinking and complexity is around studying the interconnections of these phenomena, learning to do understanding feedback loops, systems maps, scenario modeling, etc. Right? It's about being able to navigate uncertainty and also anticipate unintended consequences of actions. And finally, the movement buildings and systems change is about change agency, right? It's about practicing leadership, practicing communication, practicing advocacy, not just knowing the hard science, but how to mobilize yourself and others towards action. And these should be seen, right? These five domains, in addition to contextualizing, which are the outer rings of the education framework, they should be seen as core literacies, not just add-ons, right? These are not just things that you add on top. They are supposed to equip graduates for a better future. Next slide, please. And now, finally, the how, right, which is kind of where I want to get to before I finish. The next slide, please. First, I'd like to start by saying that we need to rethink the purpose of education. If you want to take a screenshot on this and read it a little bit with more detail later, I'll give you the citation for this in the next slide. I just wanted this to fit as big as possible. Um, Teaching planetary health is not just about, as I said, new topics, new tools. It really requires us to rethink the very purpose of education. And as this box tries to summarize, typically education is reduced to fact transfer or skills for the workforce. And that's very behaviorist, as we call it in this paper. It's informative, but it's also very narrow. Even constructivist models of education, though a bit moving further down the spectrum, often still focus on individuals. And when we talk about diversity, is more tolerated than actually fully valued. And in this paper, then, as I was mentioning, that I co-wrote with Nicole Redverse and Margot Parks, we really think about this new way of education as what we call it the praxis university, where education is thought to be transformative, inclusive, integrative, right? This means education should not only aim at personal growth, but also at societal change at large. It should actively include diverse voices, especially community perspectives, especially vulnerabilized communities, and really build that connection between knowledge and action. What does this mean practically? Next slide, please. It means we should be designing our curriculum and our courses transdisciplinarily. It doesn't mean having to pull 10 disciplines at once and calling on everyone on campus. It can be co-teaching with a colleague. It can be using resources from another discipline.
Oh, I think we lost Carlos. Hopefully he can join us back in the next minute. We'll give it another 30 seconds. Oh,
Maybe he can rejoin.
yes, crossing our fingers. Give me 1 second. I'm gonna check something.
Sorry, I'm back. I had a power outage.
Awesome. Okay.
I had a power outage. I apologize. Such is life in the tropics. Um, I think I was moving on to multiple modalities in the screen. So I really I'm now on my phone, so hopefully my internet will be stable.
Yes, we
Um, some hotspotting. So sorry about that, people watching. So multiple modalities means moving away from traditional lectures, trying things like simulations, role plays, storytelling, and really kind of using active learning techniques. The fourth would be community-based learning, which is bringing different diverse voices into the classroom, presenting them as co-educators. And this relates to the last question, who teaches, right? There's no one expert in planetary health. It's about borrowing and learning from these experiences. It's moving from extractive model of education to reciprocal relationships. And finally, when you're thinking about assessment and reflection, obviously here, instead of just, multiple question exams, you have to try different ways of analyzing how the learning is happening, including things like reflected journals, even policy memos, communication methods that we have to diversify if we want to really have these students be agents of change. Last slide, please. And this brings us back to kind of the bigger picture here. And I'd really like to finish in this one because here it shows us that teaching, right, and the art of teaching and learning is not just about transferring knowledge, which is one of the key highlight points that I want to share with you, that I've shared with you throughout. It's about shifting the whole entire education orientation of education from the outside of this figure. And I apologize if the text is small. I've put the reference there perhaps in a very badly chosen font, and that's on me. In the outside are the patterns that we know too well, right? Hierarchical structures, single ways of knowing, anthropocentric ways of teaching, and this dominates most of education today. But planetary health is about shifting, right? It's about moving towards relational care, moving towards communities of practice, moving towards economies of knowledge, as they're sometimes called. And this is not just abstract, this actually shows up quite practically in education, where we design with community partners, where we create learning environments that encourage participation, where we embed reflection as a core practice of what we do. It's not just about adding content, right? It's about restructuring the relationships that are education. It's about restructuring the methods, the values, right? This is how we move from what we have today, which is disconnection, fear, to connection and hope. I'll skip my who teaches planetary health. I'm a bit over time. I apologize again for the technical hiccup. I can still hear the batteries sounding from the power outage. So thanks again, and I look forward to the Q&A.
All righty. Thanks, Carlos. All right. So yes, passing it to Anisha. Sorry about that. I'm gonna.
No worries. Thank you, Ashley, and thank you, Carlos, for going through that very comprehensively. So I'm Anusha Senavi-Ratna. As Ashley mentioned earlier, I'm part of the Education Working Group, and I'm currently a lecturer at Royal Holloway, University of London in the UK. So I can see some poll answers are coming in already. So this is where we are doing our informal needs assessment to see how best we can support you going forward in teaching Planetary Health. So if you haven't already, or if you've logged out of Mentimeter, please do log back in. And the first question is, if you are currently teaching or interested in teaching Planetary Health, which age group or audience do you currently focus on? So we'll give you a minute or so to get your answers in. So you can see that many are focused on higher education at the moment. And if you have specified other, then please feel free to enter into the Q&A box which audience or age group you're working with, and we can, if we have some time afterwards, we can discuss. I'll give everyone another 30 seconds or so. Brilliant. Okay, so we've got lots of answers. Thank you everyone for adding them in. So I can see most of you work in higher education. We've got many of you on lifelong learning, some of you working in schools as well, primary or secondary. And in terms of other, we've got a few answers in the Q&A. So we've got faculty development, teaching in the faculty where I need to begin before reaching the students themselves, staff in public health units, the general public and non-science educated people. We have one who's a learning experience strategist with clients in tech, climate, healthcare, and NGOs, and CPD for healthcare professionals and faculty of nursing and public health. So really broad range of audiences there. So that's absolutely brilliant. I can say from our university, we also work with occupational therapists and global health students as well. We also have Indigenous communities in Kenya as well. So that's absolutely brilliant. I can also say I'm founder of the Girawa project. So we work with children in Sri Lanka and Brazil as well. So we have a really broad range of audiences receiving planetary health education, which is brilliant. And we also have another answer on NHS staff in the UK. So that's the National Health Service. So thank you, everyone. We'll move on to the next question. So this is the second of the 3 questions. So if you do teach planetary health, do you use a set of competencies or learning objectives to teach planetary health? So this is a free answer, so you can type in your answer. This is not multiple choice. Of course, if you don't teach planetary health, then please feel free to skip this question. But if you do teach, please do enter in your answers. I'll give you a minute or so to enter them in. And again, if you do use a set of competencies or learning objectives, please feel free to link it or add them in to the Q&A box. We've got lots of answers here, which is fantastic. So we have a few using planetary health learning objectives. Of course, many don't yet have the objectives, which is great, but I'm glad to see that there's so much interest. We have the Centre for Sustainable Healthcare mentioned there. So obviously this is a set of guidelines that's been set up for healthcare professionals and it's been widely used. So that's great. That's being used as well. We can see a Swiss core curriculum for all health-related universities and high schools. Teamwork, leadership, collaboration. That sounds great. Stacey, I wonder if you could scroll down a little bit to see the other answers. Brilliant. So we've got a competency tool for CGH. Again, learning objectives for education for sustainable development. So we have that related to the UN Sustainable Development Goals as well. We have one that's teaching a high school course for planetary health. GCCHE learning objectives for medical students mentioned there. Another one for medical learners at UPA and NUN in Canada. There's so many answers, it's amazing. So we have ecosystem approaches, combination of inner development goals to foster the great transition. We have the Global Consortium on CCH Competencies Framework, Sustainable Physiotherapy Practice. Have someone introducing planetary health to their colleagues in Faculty of Nursing, planetary boundaries and SDGs. Again, that's really important. So yeah, there's some really brilliant answers there, and service learning approach as well. So you can see again, really wide range of competencies used. So that's really great to see so much interest in this area, and hopefully we can continue to work together to build these competencies and learning objectives using the planetary health framework that was introduced earlier by Yelena. Okay, so let's move on to the final question. So whether you're teaching or not teaching yet, planetary health, what support or resources would help you to start or improve your planetary health teaching? So again, this is a free answer, and feel free to type in your answers here. So I'll give you again a minute or so to enter your answers in. So as you can see, there's a word cloud, so you can see lots of answers coming in already. So we've got an international curriculum, syllabi, list of key competencies, courses, lesson plans. Give you another 15 seconds or so to get those answers in, but please feel free to keep adding them in. So you can see that case studies is becoming quite a popular answer. So it's obviously brilliant that we already have many case studies on the Planetary Health Alliance website. So hopefully you will, if you're not using them already, then hopefully you will find those useful to guide your teaching. Curriculum as well, international curriculum. So that is something we are working on within the education working group, and hopefully we will be able to work with you as well to develop this curriculum that is applicable to any setting. Can see a few answers also coming up in the Q&A, ideas for field observations or community assessments, case studies. Thank you to Lucy, who's linked to the free course for nursing and midwifery. We can see many different request webinars, networking opportunities, funding, sharing previous experiences, a global consortium, games, which perhaps will be very useful for the younger audience, lesson plans, shared teaching, development of social movements, and so on. So that's brilliant. So please do keep those answers coming in, and thank you all for sharing those. So this will really help us to guide our future activities and support you with planetary health teaching. So as it's time to now move on to the next section, thank you everyone for answering the poll questions, and I will hand over to Hannah.
Hello, everyone. Good evening, good morning, good afternoon from wherever you're calling in from. I was asked to join today to speak about the Planetary Health Regional Hubs. So the Planetary Health Regional Hub program is basically we have nine regional hubs, and they're locally rooted communities of practice. Each regional hub is very different because it depends on the local context and what the regional hub needs. On my slide here, you'll see a list of the regional hubs that we have. We have them in East, West Africa, Europe, South and Southeast Asia, East Asia, Oceania, Latin America, North America, and the Caribbean. The little stars are hubs where we currently have not established a formalized regional hub. So the reason I was asked here today was to talk about how you can continue education in your local context. So what I would encourage everyone to do is the regional hubs are mainly made up of educators, and they're always interested in teaching about about planetary health and learning about how others are teaching about planetary health. Many of them have education working groups or other ways to get involved within the education sphere. So, what I would encourage everyone here to do is to go onto the Planetary Health Alliance's website, go onto the specific regional hub that you're interested in, and contact the regional hub leads. They're always interested in talking and learning about what people in the planetary health community are doing. And it's a really great way to get connected in your local regional context. That was my very brief bit. And so I'll pass it over back to Stacy, I believe, for the Q&A.
Awesome. Thank you so much. If I can just ask all the panelists to turn their cameras on, that would be amazing. Additionally, if anyone that has put questions in the Q&A, if you would like to volunteer and ask to raise your hand, I can unmute you so that you can express your question so that some of our panelists can help answer those questions. And then we can even dive into the chat to answer the questions as well. So please bear with me if you do raise your hand. I'll try to find you so I can allow you to talk. But otherwise, I'll just speak.
Absolutely. Oh, sorry. Just in the meanwhile, as you're finding the people, I did see some questions related to the difference between environmental health, One Health, planetary health. I just want to kind of be very clear that from the planetary health movement, we see fields as complementary, right? Not competing against each other. So we really understand these as a part of a solution that needs to happen quite quickly. So hopefully you are, whatever space you're working on, you're finding complementary ways towards with your colleagues and other people that might be in other fields working towards solutions because we need people on board quickly. I think part of what we've learned is that we cannot be separated in these struggles. We need to be together. So hopefully you're doing that and you're not stuck on the differences, but you're trying to find common ground with your colleagues.
Thank you, Carlos. And I will say there was a question for you, Hannah, in the chat. I think it's by Nicole Sims. So thank you for that. Is there a connection between the Planetary Health Regional Hubs and the Global Consortium on Climate and the health educator members?
So it kind of depends. Each regional hub is very unique in how they operate, and I would say there isn't a formal relationship between the regional hub program or our regional hubs and the Global Consortium on Climate and Health Education members. But what you have is a lot of our regional hub leads are part of these consortiums or are involved in other things as part of their day-to-day job as well as their regional hub. And so it depends on which regional hub, and it kind of depends on where the hub leads are coming in from and what they're doing in their other spheres.
Amazing. So once again, if anyone has put something in the chat and would like to speak up, please feel free to do so. Otherwise, I will read some of these and then our host and panelists, if they want to volunteer to help answer these questions. This might be most helpful. I'm not sure if we have time to go through all of the questions, so I'll probably pick maybe 3 to 4 and then we'll move on to our closing. All right, so I thought this one was quite interesting, and I really enjoy how some of the participants have also volunteered to answer these, but would love to hear from our panelists, like what their perspectives are. So this one is, how and where do Indigenous communities and communities in the Global South engage in developing this framework? And so I think this is referring to the framework that was mentioned by either Yelena, but I think Carlos also touched on it.
I'll take that very briefly. And I'll say when we were developing the planetary health education framework, we tried to have not just people be part of the working group that created it, be from different geographic, but also have different disciplinary backgrounds, but also as well different ethnic backgrounds as well, so we can get different perspective. But as well, we had consultations with outside groups. We opened this for consultations and we got some as well feedback. So part of those groups were the people that were either traditional knowledge holders or indigenous scholars or people that were working directly with indigenous communities. So although it's impossible to get a perfect representation of all indigenous communities around the world, given the diversity that exists, we tried our best. But what we always say is that the resources that we put out, they're not static. They're not meant to be, like certifications or standards of practice, which are a little bit more stiff. We are always open to receiving how feedback on how we can better shape this. And then the other thing I'll say is that the resources themselves are built and designed to be adaptable. So if you want to bring them down to a different context and modify it, this is just a starting point. So whether it's resources that Yelena mentioned or resources that I mentioned, these are meant to be contextualized and adaptable, right? Sorry, my choice of words there might have been wrong, but thanks for the question, though. Very important. Tina, do you want to add something?
I would just like to add that when I was talking about the 10 years of the Planetary Health Framework, I said, and that was deliberate choice of words, that the concept was articulated 10 years ago, but that doesn't mean that we are not aware that the concept has been with indigenous communities for many, many years before that. It was not maybe called Planetary Health Framework, and we are absolutely aware of that legacy.
Amazing. Thank you. And I know someone in the chat, sorry, I know someone in the Q&A just raised their hand. So if you can do it once more so I can see it. But I will hop on over to Lydia Remsman's question where it states, what entity are the Planetary Health Framework domains about? So more content related or learning objectives or competency based?
So that's another good question. We didn't mean to encapsulate the domains into a competency framework like Consortium of Universities for Global Health and other education frameworks are kind of competencies. That is, when a person goes through an education process, at the end of that process, they're supposed to be competent in that. That language is not relevant to all of the world, right? It's relevant to some parts of the world where other disciplines might use other things like entrusted professional activities. Other parts of the world will use other types of language. So because we wanted to keep it generic enough that it could be adaptable, we didn't encapsulate it into, either learning objectives or competencies. I will put a plug in for the work that people are already doing, trying to transform the education framework into competencies, into education frameworks for specific disciplines, for specific degrees, right? So one of those groups is the Gecko group that there was a mention on that in the chat, led by Dr. Catherine Jacobson, in which what they did, and with a working group that I was involved with as well, and many others, but led by the Gecko group, is that they transformed the education framework into learning objectives for global health learners. So again, this is a transformation from a high level domains into bring it down to the level of education objectives for a specific field. Now that work is being done in nursing, it's being done in medicine, it's being done in other fields. So that's how we imagined it being used, and we're glad that it's being used like that.
Amazing. Thank you for that response. And I know we're at time, but we do have, hopefully we'll be able to answer all the any questions that weren't fully answered. But this is a very great question and it was pinned. So if we have 2 seconds, this was asked by Francisca Boar. Regarding new methods, do you have any kind of overview on methods and examples in planetary health context for transformative learning, like storytelling, role play, or reflective journals? And then we'll end there.
I can take that one. So as Ashley and Stacy and Anusha mentioned, as members of the Education Action Group, we are actually focusing on creating some of this. And part of this is the storytelling piece of our work, is that we are creating actually 3 lines of stories, video stories on personal experiences, focusing on global nature of planetary health and interconnectedness of planetary health challenges worldwide. So the first one is focusing on personal experiences. The second one on the awakenings of the moments, like when people share their stories, when did they become aware of the moment and the extent of the global environmental crisis? And then also trying to kind of be positive and focus on success stories. We are asking people to share their planetary health success stories. And by success has very different meanings and faces and looks differently in different contexts and settings. And that is what we wanted to share. So yes, we are working on that, and we're going to be able soon to add that to the resources on the Planetary Health Alliance's website. But I would like to say that storytelling we find extremely important at this moment in time, in the current climate where the science is under attack and facts are under attack. And that doesn't mean by doing storytelling that we are moving away of the good fight for science and for the facts, but we are trying to kind of also look at from a different angle and try to connect with people through storytelling in this very polarized political moment.
Thank you, Yelena, for that. All right, everyone. So we will do our best to, answer any questions that have not been answered in the Q&A, and maybe we'll do personal outreach, but I'll pass it back to Ashley here.
Thank you, Stacy, and thanks everyone for our panelists, Yelena, Carlos, Anusha, for leading us through really nice information and the polling. Thank you everyone for your interest and participation in these polls. Really fascinating to see the diversity and the interest. So that's really exciting. So I just want to this last slide that we're showing is provides a couple of QR codes for one is the upcoming Planetary Health annual meeting, which is being held in Rotterdam, the Netherlands this year, as well as this excellent resource for planetary health education that was put together by the PHA. So I encourage you to check them out. Again, if there were any questions in the Q&A that we couldn't get to, we'll try to follow up by email. And I just want to thank you again and to stay tuned for future webinar offerings and do encourage you to maybe check out your regional hubs that kind of make sense to you to connect with them, because that can be a nice way to start with a community of practice and find others who are also working in this space. So thanks again, everyone, and take care and enjoy the rest of your days or evenings or tomorrows, if depending on what time zone you're joining in. Thanks a lot, everyone.
Thank you.
Bye, everyone.
And we will send the slides. I hope everyone has a good rest of their day.
Thank you. Bye.